20% of the body weight. Two types of the extracellular, the interstitial between the cells and intravascular within the vascular system. The age-related fluid changes. Full-term baby, about 80% of the total body weight is fluid. Lean adult male, about 60%, while the aged one, the elderly people, about 40%. You see here that in pediatric age group, 80% of the total body weight. Just a minute, please. بدي يخلونا نحكي كل شوي جاي واحد المفروض يعني قبل الوقت يا شباب كلكم حاضرين. Okay. This is how does the fluid and electrolytes transport, the passive and active transport. هاي انتم تقروها مهمة بالنسبة حتى مضيع الوقت. Diffusions, filtration. This is how does the fluid move. Basic physiology. The fluid types, you have to know the fluid types. The isotonic fluid, the hypotonic fluid, and the hypertonic fluid. The isotonic solutions, no fluid shift because solutions are equally concentrated. The best example is the normal saline, 0.9% NaCl. Here, the isotonic solutions mostly used in the surgical and non-surgical practice. Now, the hypotonic solutions, low concentration, low solute concentration, a fluid shift from hypotonic solution into the more concentrated solution to create a balance. Here, this cell will swell. For example, half normal saline solution. This is the hypotonic solution. While the hypertonic solution, high solute concentration, يعني تركيز ماله عالي, fluid is drawn into the hypertonic solution to create a balance. Here, this cell will shrink. For example, hypertonic 20% dextrose. This is the second type regarding the tonicity. And the hypertonic and the isotonic. Now, how does the fluid أنس متأخر يا أنس. How does the fluid compartments are regulated in the body? The baroreceptors reflex respond to the fall in the arterial blood pressure. These baroreceptors, located in the arterial wall, in the vena cava, in the aortic arch, and the carotid sinus. The baroreceptors constrict afferent arteriole of the kidneys, resulting in retention of fluid. The volume receptors, and how does the fluid compartments are regulated? Respond to the fluid excess in the atria and the great vessels. The stimulation of these receptors creates a strong renal response that increases the urine output. The other system that regulates the body compartments, what's called the Renin-Angiotensin system. The angiotensin 1 is converted in the lung to angiotensin 2 using the angiotensin converting enzyme that produce vasoconstriction to elevate the blood pressure and stimulate the adrenal cortex to secrete the aldosterone. The aldosterone, an aminoglycocorticoid that control sodium and potassium loss and increases chloride and bicarbonate concentration and the fluid volume. هذا كله بدنا نحكي physiology. The other hormone that control the body fluid compartments called the antidiuretic hormone. It's called also vasopressin. It's released by the posterior pituitary when there is a need to restore the intravascular fluid volume. Release is triggered by chemoreceptors in the third centers in the hypothalamus. When there is fluid volume excess, يعني من يزيد الفلويد, decrease antidiuretic hormone secretion. While when there is deficit in the fluid, it will increase the antidiuretic hormone. Now, the problems in the fluid imbalance. There is dehydration, there is hypovolemia, there is hypervolemia, and there is water intoxication. So there is dehydration, there is hypovolemia, there is hypervolemia, and there is water intoxication. تسمعون اخوان؟ بدنا نحكي شوي سريع بس بعدين يعني اذا عندكم اسئله ممكن يعني نهايه المحاضره، اوكي؟ حتى ما نضيع الوقت. Dehydration. Okay. Means loss of body fluid, يعني الجفاف. So there will be increased concentration of solute, يعني نفقد الفلويد فيصير تركيز السوليوت in the blood and rise in serum sodium level. The fluid will shift out of the cell into the blood to restore the balance. يعني يصير dehydration الفلويد تتحرك من داخل السيل تطلع برا للintravascular to correct this deficiency. The cells will shrink, يعني الخلايا راح يصغر حجمها from fluid loss and can no longer function properly. This is the problem of dehydration. There will be shrinkage of the cells because of loss of the intracellular volume, according to the mechanism that I have talked about in the beginning of the lecture. Now, who are at risk? Clients at risk of dehydrations. I mean, the confused one, the comatose. يعني هذول راح يكون ال effect of dehydration more than the other people. The bedridden, يعني واحد نايم على السرير. Infants, elderly, and internally fed. Internally fed اكو يسمونها parental nutrition. هاي بالمستقبل نحكي لكم عليها، يعني التغذية الوريدية الكاملة. هذول الجروب, those group are more at risk than the other population. Now, what we see, what do we see? What do you see in signs of dehydration? Irritability, confusion, مريض دايخ, dizziness, weakness, ريحان وين كنت يا بنتي؟ ريحان تسمعني؟ ريحان جاسم استاذ وين كنت انت يابا؟ تسمع يا ريحان ولا ما تسمع؟ الو؟ طالب انتي؟ يابا حضرتك وين كنتي؟ تسمعين ريحان؟ يا الله ما لازم غلست. اوكي. extreme thirst عطش decrease urine output. Fever, dry skin and mucous membrane, sunken eyes يعني عيون الغيرة, poor skin turgor يعني الجلد يصير ما بي مرونة, and tachycardia mean increased heart rate. All these signs seen in a patient with dehydration. So what we do for that people who are undergoing dehydration? Fluid replacement, oral or intravenous over 48 hours with monitoring of the vital signs. يعني كل ما يحتاج المريض هو الفلويد سواء orally أو through the intravenous route. Maintain input and output, I and O. Maintain IV access. Those people should have يعني تحصلوا كاملة. لماذا؟ لأنه there will be shock state, decrease in the blood pressure. In the advanced cases, you cannot get a venous access. Maintain IV access and daily weight. يعني يوميا توزن هذا المريض to assess dehydration status with the skin and mouth care. Those people with dehydration, there will be also dehydration of the skin and the oral mucous membrane, and there will be chance of infection. So there should be maintenance and care about the oral hygiene. Now, the second point, this is the dehydration. The second problem is what's called the hypovolemia. What's called hypovolemia. Hypovolemia means isotonic fluid loss. Isotonic, I said, fluid loss from the extracellular space, from extracellular place, and can progress to hypovolemic shock. Caused by excessive fluid loss, for example, hemorrhage, bleeding, نزيف, or increased fluid intake. واحد ياخذ fluid هواية, or third space fluid shifting. In some cases of acute pancreatitis or other intra-abdominal major insults مثل SAM suction أو غيرها, يفقد الفلويد إلى what's called the third space in a compartment that cannot be used or utilized furthermore. This is called the third space. You listen well, please. Okay. What we see, what are the signs of hypovolemia? Mental state deterioration, يعني القوة العقلية أو الذهنية تشوف المريض دايخ. Tachycardia, decrease heart rate mean. Decrease capillary refill. Rihan, left. Marwan, also left. Okay. What we do? Fluid replacement, albumin replacement, blood transfusion for hemorrhage, dopamine to maintain the blood pressure, صراحة ما راح نحكي لا تنهزم مثل ريحان لأن زعلت هذه الأفندية. Thirst, tachycardia, delay capillary filling, hypotension, decreased urine output less than 30 ml per hour, cold pale extremities are weight loss. All these are signs of hypovolemia. What we do, يعني مريض فقد الفلويد, fluid replacement, albumin replacement, a blood transfusion for hemorrhage, dopamine to maintain blood pressure, trousers يعني هاي نوع من البنطلون يلبس for severe shock to help to return the venous drainage, assess for fluid overload with the treatment. Now, hypervolemia, excessive fluid in the extracellular compartment as a result of fluid or sodium retention, excessive intake, or renal failure. When does happen? It occurs when compensatory mechanism fail to restore fluid balance, lead to congestive heart failure, CHF, and pulmonary edema. What we see in hypervolemia, tachypnea يعني respiratory rate will increase, dyspnea, ضيق نفس, crackles or crepitation. When you put your stethoscope, خلي سماعتك على صدر المريض راح تسمع crackling sound, درقعة يعني, rapid bounding pulse, hypertension, gallop rhythm يعني الهارت ريت تسمع مثل الشغل الثالث هذا الساوند، هذا المستقبل ان شاء الله تاخذونه. Increase central venous pressure, acute weight gain, jugular vein distension, GVD, jugular vein distension, and edema. All these are signs of hypervolemia, or the signs of hypervolemia. We have another term called edema. Fluid is forced into the tissue by the hydrostatic pressure. يعني fluid بروح interstitial space. First seen in the dependent areas. يعني نشوف دائما الإدمة أو الورم بالمكانات المنخفضة بالجسم، مثلا الساق أو الساكرم. ساكرة. Pitting edema and pulmonary edema. 8 types of edema. What we do يعني إذا واحد عنده fluid overload, fluid and sodium restriction، ما تنطي fluid. diuretics المدررات، okay. Monitoring of the arterial blood gas analysis, maintain intravenous access, skin and mouth daily weight. Now, we have another term called water intoxication. Water intoxication. The water intoxication, hypotonic extracellular fluid shift into the cell. بالwater intoxication يعني ياخذ المريض fluid and the extracellular fluid will shift it into the cell to attempt to restore the balance. The cell will swell، الخلايا راح تنفخ. The causes of water intoxication: سيادة syndrome، هذا مختصر، syndrome of inappropriate antidiuretic hormone secretion. Antidiuretic hormone secretion from the posterior lobe of pituitary gland, if it's secreted in an inappropriate way, it will increase the fluid retention. Rapid infusion of hypotonic solution، يعني واحد ياخذ fluid hypotonic بسرعة ممكن يصير water intoxication. Excessive tap water, nasogastric irritation or enemas. مرات نسوي تنظيف او غسل المعدة او انيمة الحقن، فهاي يمكن يسوون water intoxication. و اكو what's called the psychogenic polydipsia، هذول عندهم psychogenic يعني abnormal psychogenic problem، فيشربون مية هواية ممكن يساعدهم water intoxication. What we see signs of water intoxication: signs and symptoms of increased intracranial pressure، يعني يصعد الضغط داخل الدماغ. early signs: change in the level of consciousness LOC level of consciousness. يعني نشوف المريض الكونشسنس ماله او الوعي يبدي يتغير. nausea and vomiting تعبان نفس وزواع. muscle weakness twitching يعني تشوف نوع من التقلصات بالعضلات. cramping نوع من الايضا widened pulse pressure seizure and coma. What we do, prevention is the best treatment. Assessment of the neural status, monitor input and output with the fluid الو صوت واضح؟ العفو. صار شوي اشكال يعني رجعنا للربط القديم الجديد. بس نكمل ان شاء الله. Water intoxication in psychological polydipsia. What we see, signs of raised intracranial pressure, early signs in change in the level of consciousness. كان الوتر intoxication العفو هو نعم water intoxication دكتور العفو. هذا سلايد تشوفوا. الو ايه احنا قلنا الكوزز اوف ووتر انتوكسيكيشن السندروم اوف unappropriate انتيديوريتيك هرمون سكريشن ورابد انفيوجن اوف فلويد وممكن الايديماز او جاستريك irrigation والسايكولوجيكال بوليديبسيا. السايكولوجيكال بوليديبسيا انه المريض ده يشرب كميات هوايه من الفلويد فيصير هذا الووتر انتوكسيكيشن. What we see is signs and symptoms of raised intracranial pressure, early signs, change in the level of consciousness, الوعي يتغير, nausea and vomiting, muscle weakness, twitching and cramping. Late signs of water intoxication, bradycardia بالعكس الدقات تكون يعني بطيئة, widened pulse pressure يعني الفرق ما بين systolic blood pressure and diastolic high, and lastly coma. What we do, قلنا prevention is the best treatment, assessment of the neurological status, monitoring of input-output, fluid restriction, intravenous access, daily weight يومية وزن المريض, monitoring وسيزر precaution. سيزر يعني fit أو epilepsy. نجي على الموضوع الثاني هو electrolytes. موضوع electrolytes. The electrolytes in general are charged particles in a solution, either cation اللي هي الموجبة يسمونها cation or anion اللي هي السالبة, cation or anion, integral part of metabolic and cellular process. يعني جزء مهم من metabolic and cellular process, the electrolytes. The positive or negative, the positive cation including sodium, potassium, calcium and magnesium. These are the positive. While the negative anion, the chloride, bicarbonate, phosphate and sulfate. The major cations, extracellular major cation اللي خارج السيل هو الصوديوم, while the major intracellular cation is the potassium. Electrolyte imbalance include hyponatremia or hypernatremia يعني الصوديوم, hypokalemia or hyperkalemia, hypomagnesemia or hypermagnesemia, hypocalcemia or hypercalcemia, hypophosphatemia or hyperphosphatemia, hypochloremia or hyperchloremia. Fluid and helps to preserve the fluid volume, combines with chloride and bicarbonate to help regulate acid-base balance. Normally range between 130 and 145. Hyponatremia, many types. اسمعوني اخوان. كلير كلير. ايه راح ان شاء الله نكمل الجزء الثاني من المحاضره الاسبوع القادم ان شاء الله. واذا صار عندكم مجال قبلها ممكن يعني حتى لو بالليل مثلا نشوف ساعه او نص ساعه مناقشه على هالموضوع هذا. شوف وقت مناسب عندكم. الو ما مشكله. راح شو اسمه حيدر انطي رقمي جناني او على الجلاس روم. شوف وقت مناسب حتى لو مثلا بالليل. ماشي ان شاء الله ان شاء الله. شكرا جزيلا for the time being. Thank you. شكرا. اسف يعني